Hi there, and thank you for your interest in learning more about food testing and more specifically FoodTest95. My hope is that this short video will help shed some light on food allergies, sensitivities, and intolerances, and how eating the wrong foods can dramatically impact your health. At the conclusion of this video, the doctor or staff will be able to answer any additional questions you might have. Now, before we get into the benefits of food testing, let's look at some current statistics. Current research is showing that 83% of health conditions are food-related. 83%. So eating the wrong foods can be linked to weight gain or weight loss resistance. Then you have diabetes and cholesterol issues and heart disease and digestive disorders, migraine headaches. These are all, for the most part, food-related with an underlying inflammatory cause. We'll talk more about inflammation shortly. But 69% of the US is overweight or obese, projected to be 80% by 2020. Something has to change. What we're doing in terms of diet and nutrition is not working. Now here's some more statistics. Heart disease kills 2 out of every 3 people. Cancer kills 1 out of every 3. So this is 5 out of every 6 Americans, either cancer or heart disease. You don't see this in other countries. Then you have 50 million Americans that are suffering from an autoimmune condition. Autoimmune conditions are epidemic. Lupus, MS, rheumatoid arthritis, celiac disease, Crohn's disease. There are nearly 100 recognized autoimmune conditions. Now let's look at some conditions that can be helped by getting food tested. Migraine headaches, obesity or weight challenges or weight loss resistance. People that have tried everything and really have a hard time losing weight, but not only that, they have a hard time keeping it off long term. Okay? Chances are they're eating the wrong foods. They're eating foods that are causing more inflammation in the body. It's really hard to lose weight when the person is so inflamed. Digestive problems, or IBS or leaky gut. A lot of these conditions can be linked back to a gluten sensitivity. And research has shown that 40% of the entire country is gluten intolerant. And if this is the case, gluten can destroy your small intestine. Your small intestine is where you absorb all of your nutrients. So then what happens is you become nutrient deficient. And it's really the deficiencies that can lead to over 200 different conditions. So again, this is why we test. We don't guess at things, we test. Chronic fatigue. Thyroid problems. In terms of thyroid, 90% of low thyroid is Hashimoto's, which is actually an autoimmune condition. So it's your immune system that is attacking your thyroid. Now, if it's your immune system that is the issue causing your thyroid problems, wouldn't it make sense to find out how your immune system is reacting to foods? To me, that just makes sense. Achy joints, achy muscles, back pain. This goes back to chronic inflammation, total body systemic inflammation. When you eat the wrong foods, this spikes inflammation, and this in turn causes pain. Skin problems, eczema, psoriasis, acne. Kids who have ADHD, a lot of times ADHD can be linked back to a food intolerance. So these are the most common conditions that can be helped by getting food tested. These are the people that need to be food tested right away. This should be the first diagnostic test, so to speak. Let's get rid of the bad foods that the patient is reacting to, and let's customize a healthy, acceptable food list for them to choose from. Let's let the body heal itself without harmful drugs. Now, what is FoodTest95 and more specifically IgG, food sensitivity or intolerance testing? Food sensitivities have been a very popular topic lately. It's been on Dr. Oz several times, but FoodTest95 is checking for the delayed immune response to foods. So in other words, everybody reacts to food differently. Some people might react to gluten or wheat, barley, and rye. Others might react to eggs or dairy. And believe it or not, some people might even react to certain fruits and vegetables. And we've seen it time and time again. Some people might react to chicken or apples or spinach. Again, everybody reacts to food differently. Now remember, we're testing for the delayed immune reaction, which is also called an IgG response. We're not testing for food allergies. A true food allergy is dealing with the IgE portion of the immune system. So in other words, a person might have shrimp and their throat swells shut. They might even have to carry an EpiPen for emergencies. So what we're testing for is the 10 to 12 hour, sometimes up to 72-hour delayed reaction. This time frame is simply too much to do any sort of elimination diet, and this is why we test. A person might have eggs or peanuts, and the next day they have a migraine headache or digestive issues or feel achy and inflamed. Again, this time frame is simply too much due to any sort of elimination diet, which is why we test. Now this person, believe it or not, reacted to kidney beans and pineapples. Pretty amazing, huh? You know, the things that most people would consider healthy may not be healthy for you. The standard American diet is very processed, is very toxic, and is very inflammatory. And by toxic, I mean a lot of artificial ingredients, high fructose corn syrup, preservatives, colors, dyes, artificial sweeteners, and various toxins that have been shown to cause disease and dysfunction. Food sensitivities and intolerances have been shown to spike inflammation. Chronic, long-term, total body, or systemic, low-grade inflammation because of eating the wrong food choices have been shown to be the root cause of numerous health challenges. Now, when you look at the top 10 causes of death in the United States, 7 out of 10 have an underlying inflammatory component: heart disease, cancer, respiratory disease, stroke, Alzheimer's, diabetes, kidney disease. Now, I don't want to share with you this slide to depress you or make you stressed. I just want to make you aware of what's happening in the US right now. Most people don't know that the foods they eat radically affect your overall health. Now, the report looks like this, and from this report, we're able to customize a food list for the patient. A food list that is healthy, lean meats, fruits and vegetables, nuts, seeds, beans, but of course customized based on how your body reacts and what your blood work shows. And we test about 100 of the most common foods that people eat on a daily basis. And what we do is we get rid of the culprits that the patient is reacting to. Now the test is super simple. It's a little finger prick that takes less than 3 minutes. We let the sample dry and then we send it off to the lab for analysis. 95 foods are tested to determine exactly how you react to each food. We'll get the report back in about 10 to 12 days. And then from there, we're able to customize your master food list based on what your blood work shows. We have many success stories from people that have gotten tested, problematic foods or inflammatory foods were removed, and their symptoms cleared up. FoodTest95 is in hundreds of clinics all across the country, and your doctor, by offering food testing, is on the cutting edge of nutrition and functional medicine and really getting to the underlying root cause of health challenges. Remember, we have to remove the foods that are harming the immune system, harming the digestive system. And once we do this, we see a lot of great things happen with patients. Thank you for watching this video about FoodTest95. The doctor or one of the staff members will be with you shortly to answer any additional questions you might have.